ASL4Responders. My name is Samika, and I started this channel because I think one of the most important components of healthcare is communication. When people think about emergencies, they think about sirens, ambulances, oxygen masks, maybe tons of people coming in to help. But sometimes one of the biggest problems in the room is quieter than that. Sometimes the problem is that a patient is scared, they're in pain, maybe they're struggling to breathe, and they don't know, and the person that's trying to help them doesn't know how to communicate with them. This isn't a small issue. In the United States, we see millions of people speaking a language other than English at home, and Spanish is one of the most common among them. Millions of people are also deaf or hard of hearing, and many rely on forms of communication, such as American Sign Language, interpreters, captions, writing, or gestures. But when this communication that we know breaks down in healthcare, it isn't just awkward. It affects comfort, affects safety, and it affects whether a patient really understands what's happening to them. As an EMT myself, I've become really aware of how communication matters in those very first moments of care. When I've heard healthcare workers say versions of, I wish I knew more Spanish, it helps you understand that even a basic phrase can help make an interaction feel less confusing for a patient. With ASL, I think that gap can feel even larger. A lot of people want to communicate respectfully with deaf or hard of hearing patients, but they don't know where to start. If you put yourself in the shoes of one of these patients, you might be experiencing the worst chest pain of your life, and your healthcare provider has to communicate with your mom, maybe your dad, your spouse, your brother, or your sister, and they can't look you in the eye. And the problem with that is, I think being a patient means putting your life, putting your health, and your well being in the hands of someone you've never met before. And it can feel really frightening when you're in that much pain and your healthcare provider can't communicate with you. So that's where ASL4Responders comes in. It's focused on basic ASL and Spanish phrases for those real patient care moments. It isn't just random vocabulary, it's definitely not full medical interpreting, but it's for those real moments when you want to ask, are you having trouble breathing? Where does it hurt? I'm going to check your blood pressure. Even the simplest phrase, I'm here to help you. These phrases are simple, but imagine being that patient again. It can change the entire feeling of a moment when your healthcare provider can communicate in your own language. On this channel, I'll be sharing individual word and phrases in ASL and Spanish, and I'll be doing different series. One series is called One Call, Three Ways. So I'll take a common patient scenario. As an EMT, I often see patients like chest pain, falls, or other patients like patients who have had anaphylaxis or trouble breathing. And so what this series will do is I'll run through the patient scenario in three ways. I'll run it through in English, Spanish, and ASL. And I'll be sharing another series called Barrier Breakdowns, and we're going to talk about language access and common healthcare miscommunications. I think that learning a language is definitely important, but also understanding the way it fits into the role of healthcare and into the way we do communicate is really important. And I want to be very clear that what I'm teaching here, it's not medical interpreting. We're definitely not on that level. Interpreters are essential for diagnosing diseases, for talking about complex medical information, and this isn't equivalent to that yet. But what this can do is this can help you build a foundation. It doesn't mean that basic phrases are useless. These phrases can help you introduce yourself. They can help you comfort someone who's in a lot of pain, and they can help you explain simple actions. And that really matters. You don't have to be fluent just to start learning. You just have to be willing to take that extra time and start. So whether you're a first responder, healthcare worker, maybe you're a student, maybe you're a volunteer, or maybe just someone who's interested in making care more accessible, this is the channel for you. This is ASL4Responders, and it's just the beginning. So please subscribe for more ASL and Spanish phrase videos, patient scenarios, and language access stories. And follow ASL4Responders on Instagram as well.